Leprosy is a disease known to man for centuries and centuries, even before Christ. It's an infectious disease that has neurological manifestations. The infectious pathogen is similar to that caused by tuberculosis. What happens that there can be an attack on the skin that causes numbness, and if you're unable to feel pain, you obviously may not be able to maneuver and manipulate your environment as appropriately as if you had no issues. There are other manifestations of leprosy that include a change in your face, again, changes in your sensation. Sometimes you can lose digits because of what we call auto amputation. So your body just kind of, for lack of a better expression, eats away at itself. The medical benefit scheme does carry a medication called dapsone, which is one of the classic treatments that is very effective for leprosy. It's important to note that globally, leprosy is still fairly prevalent. So if you make travel arrangements or you're planning to travel, just be aware that this is a disease that exists. And again, look out for the manifestations of the changes of the skin and the changes in sensation. And it's important to get evaluated by the closest physician so we can take care of things. Although leprosy is rare, it's important to be aware that it's a disease that exists, and it can be extremely debilitating and life-threatening. So if you have any changes to your sensation or any changes to your skin, it's important to see your primary care doctor, who may or may not manage your case or send you to the appropriate specialist. Sometimes it takes a multidisciplinary approach between your primary care doctor, dermatologist, and neurology.